Welcome to Pharmacy 109, Body Systems, Diseases, and Drugs. We're going to start off with a pre-course review in medical terminology before we start into the content of the course. As an introduction, reviewing that healthcare professionals use medical terminology, and it's kind of like speaking a foreign language. In the textbook, the first two chapters lay out the foundation for learning and understanding terminology relative to anatomy and physiology. We are only going to review Chapter 1 for this course. Chapter 2 is medical terminology. You either have already completed medical terminology or currently enrolled in that course, probably. So we're not going to spend time in this course reviewing that. Future chapters will build on the foundation. It will take us to the journey's end, and at that point you'll not only understand anatomy, physiology, and disease, but also be able to speak the language. It's very important that when talking with other professionals we use the appropriate terminology, but even more important is when we're given that terminology that we can then translate it back into the common language when talking to our patients. So we're going to have like a little self-quiz kind of thing just to review some terminology. So question number 1. Which of the following positions is described as lying face down? That would be prone. Question number 2. Which of the following has the opposite meaning as proximal? The opposite of proximal is distal. So proximal means near, and distal is distant or away. The depressed area located in the front of the elbow is known as that's the antecubital. Now that's important because when we talk about using IV therapy for patients, that is the most common site for an IV line in sterile administration of IVs. In which body region are the buttocks located? That would be gluteal. Which of the following terms describes being able to breathe easier in an upright position? That would be orthopnea. Ortho, upright, pnea, breathing. Now, I do want to draw your attention to the selection B, which is orthostatic hypotension. That's a term that we'll use a lot, probably in this course, but also when we're talking in pharmacology. That means there's a drop in blood pressure when you stand up too fast. Next question. A sudden obstruction of a blood vessel by debris is known as? That would be an embolism. That could be air, it could be fat, or it could be a blood clot. Which of the following contains the digestive organs? That would be the abdominopelvic cavity. Which of the following regions houses the navel? That would be the umbilical region. That's where the umbilical cord is connected at the navel or the belly button. Necrosis means? Necrosis is tissue death. Often necrosis occurs as a restricted blood flow resulting in a lack of oxygen to tissue. And when it doesn't get enough of those nutrients, the tissue begins to die off. Okay, so there's just some midterm review to get you started. As you progress through this course, you will have more lessons like this pertaining to the chapters. So good luck and have a great semester.